Hello everyone, thank you for joining me. My name is Dr. Jason Uchida. I'm a doctor of naturopathic medicine and your host of this program. Welcome to Island Wellness, a program designed to educate you about naturopathic medicine. I graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1988. I've been practicing naturopathic medicine in Hawaii for the past 21 years, going on 22. Naturopathic physicians are licensed in the state of Hawaii as primary care providers, just like medical doctors. Let me give you a brief introduction to naturopathic medicine. Naturopathic medicine is a primary care system founded on the honored universal principle that the human body has the mechanisms in it to heal itself, no matter what the current status may be. Therefore, the human body is the ultimate healer. Furthermore, a physician's true role is to support this process by using modalities of treatment that work in harmony with the body's natural healing ability. Hippocrates, the father of modern medicine, practiced these same principles thousands of years ago. Well, that's enough about me and naturopathic medicine. Now let's find out if it works. To help illustrate this, I typically ask a patient to share his or her experience with naturopathic medicine with you so that you can get a better understanding of how this safe and effective form of medicine works. Today we have a very courageous patient joining us to share her story of how she overcame a trifecta of severe pain and suffering. She'll share her story of beating severe depression, chronic dishydrotic eczema, and chronic migraine headaches with naturopathic medicine. Eczema is the most common, tenacious, and bothersome skin problem we have in America today. Dependent on the medical textbook you read, eczema affects between 6 and 12% of us on a regular basis. Its definition in Greek means to boil out. At its worst, this is exactly how the skin of eczema may look. The skin gets swollen, red, bumpy, and spongy with serum. The serum can weep out of scratched and aggravated skin. When the serum dries, it hardens into a crusty scab. When it becomes a chronic problem, the skin may become scaly or crack open into painful fissures. Individuals suffering from chronic eczema who scratch constantly will develop several layers of thickened, hard skin with a gray or blackish pigment. The eczema can occur in patches and affect one small area, or when it's at its worst, it can cover the entire body. Eczema usually affects the folds of the body, such as the inner elbows, the wrists and ankles, back of the knees and legs, the buttocks, and behind the neck and ears. But when eczema is at its worst, no area of the skin can be left untouched. Typically, a person with eczema suffers from an unquenchable, voluptuous itch. It is the maddening itch of eczema that drives people crazy. The itch typically intensifies when it is hot and humid, and at night while trying desperately to sleep. It is during these moments that the itch can become so intense that the victim scratches until the skin is shredded into a tattered rag of open wounds, weeping of serum and blood. So how severe is severe? Medicine considers eczema that is covering 2% or less of the body as being mild. The surface area of one palm of the hand is considered 1%. A moderate case of eczema is 3 to 10% coverage, and a severe case of eczema greater than 10%. What makes eczema one of the most frustrating skin conditions is that conventional medicine has no cure for it. That's right. If you have eczema and you ask your medical doctor if the treatment will cure it, unfortunately he will tell you no. You ask, why doesn't conventional medicine have a cure for eczema? Simply put, it really is not trying to cure eczema. According to medicine, immunology, and science, eczema is caused because there are toxins inside of the body. Our immune system responds to these toxins, which are also called antigens, with what is called a type 3 hypersensitivity reaction. Basically, in the type 3 immune system response, the immune system sends out immune system cells called antibodies. These antibodies are like security guards and janitors that gather up all of these toxins or antigens, grabs holds of them, and escorts them out of the body through the skin. As the antibodies corral the antigens, they fix complement to the toxins. Complement is like a chemical distress signal, a call for help, a rescue flare that guides other immune system cells to the toxin. Complement is like what jet plane fighters use to guide their missiles to its target. The jet fighters paint an infrared marker on its target to guide its missiles to the tank or the building it wishes to destroy. Complement guides other immune system cells called polymorphonuclear leukocytes, otherwise known as PMNs, to the targeted poisons. When the polymorphonuclear leukocytes find the antigens, they release chemotactic factors, which act like acids that destroy the targeted toxins. And just like the missiles from the jet plane fighters damage more than its intended targets, PMNs and its chemotactic factors also accidentally damage other structures or tissue nearby. In the case of eczema, collateral tissue damage from the type 3 immune system reaction produces the red, inflamed, bumpy, itchy, weeping skin. So in essence, eczema is actually a good thing. Eczema is a result of your body's immune system doing its job and eliminating the poisons out of the body through the skin. However, this skin problem irritates us and looks really bad, so we don't want it. So we go to the medical doctor for relief, because medicine, immunology, and science understands that eczema is a result of our immune system removing toxins through the largest elimination organ of the body, the skin. Conventional medicine uses corticosteroids and other immunosuppressive medications that stop the immune system from removing these poisons through the skin. So when you use these immunosuppressive drugs, the eczema subsides because the immune system has been stopped in performing its job by the medication. However, when the immunosuppressive drugs or medications wear off, or its use has stopped, what happens to the eczema? It comes right back, and usually worse than its initial onset. Why worse? Because now there are more toxins inside the body than before, because the immunosuppressive medications have kept the toxins inside the body, not letting the immune system release the poisons out. So the toxins have been accumulating over time. And that is why conventional medicine doesn't have a cure for eczema. It chooses to stop the poisons from being released. Conventional medicine treatment dances around the cause of eczema, creating a sense of false hope that you do not have to pay the piper. Unfortunately, most people who suffer from eczema learn that using corticosteroids and other immunosuppressive medications lured them unsuspectedly into a tangled mess of escalating disaster after disaster. Naturopathic medicine looks to identify what these toxins are, then eliminate them from the body, and finally prevent it from re-entry or its reproduction from within the body. This would be similar to draining a pool filled with dirty fluid or dirty water. After draining the dirty pool of water, one shouldn't refill the pool with more filthy, dirty water. Otherwise, it will require additional ongoing draining, which is what occurs to individuals who are using corticosteroids in the treatment of chronic eczema. In a nutshell, that is how naturopathic medicine works in cases of eczema. Identify the cause of the illness, address and fix the cause of the problem. So let's find out how naturopathic medicine stacks up against the incurable eczema, depression, and migraine headaches. Joining us today is my patient Gail. Gail is going to share her story of the nightmare she lived through with suffering from severe and difficult to shake depression, constant torture of chronic dyshydrotic eczema, and her recurrent bouts of sledgehammer pounding migraine headaches. She'll tell you how bad her depression, and eczema, and migraine headaches were, what type of conventional medical treatment she received without relief, and what she did to help her beat this biblical-like skin affliction and the nightmare of living with depression and constant threat of debilitating migraine headaches with naturopathic medicine. With that being said, let's get started and introduce my special guest, my patient Gail. Gail, welcome to Island Wellness.
Thank you.
Gail, your situation was pretty bad. I mean, you were sick, suffering from migraine headaches chronically, dyshydrotic eczema, and depression. Would you describe how bad your eczema was for the audience?
My eczema started off as skin peeling on the bottom of my foot. And so when I went to my doctor told me I just had a little irritation. But it got progressively worse. I went to a dermatologist, and all she had me do was go under this blue light for like 5 minutes. Not even 5 minutes. And I had to do that 3 times a day. And that wasn't helping. And I think the reason why I came to see you was because my husband was refurbishing our kitchen cabinets.
Okay.
And I noticed that my pores were really large and I was scratching. So I thought the part of the particles from the kitchen cabinets got into my skin.
Okay.
So when I went to my doctor told me I had a little skin irritation. He gave me some medication to take and some cream to put on, but nothing was helping. And I remember my son telling me to come to see you, and I hesitated for like 3-4 years, and I finally decided to come to see Dr. Uchida. And the first thing he told me was, I have eczema. And I said, no way. But after he told me what the symptoms were, and he asked me all these questions, and he told me that I had to change my diet, I said, I don't think so, but that's what it was. It was because of that really bad skin irritation.
How long did you suffer with the eczema? From the beginning till before you came in to see me?
Well, maybe over a year.
A year, okay.
Yeah.
There were other areas of your body, though, affected by the eczema. Where were you affected?
I know my foot was really bad. You know when you talk about dry skin, when people talk about dry skin, I think mine was worse than that. And my eyes always itched a lot. And my eye doctor told me that I had conjunctivitis. Dr. Uchida said, no, that's part of my eczema. And my hands would bleed. It would get dry, it would crack, and then it would start bleeding.
So the palms of your hands and the soles of your feet were affected, which is unusual when it comes to eczema, but that's why it's called dyshydrotic eczema. How it appears is maybe it looks initially like tapioca pearls underneath the skin.
Exactly.
And it's like bubbling out.
Yes.
And when it breaks the skin, it becomes really, really itchy.
Exactly.
Would you mind sharing with the listening audience, viewing audience, how itchy your eczema was?
I mean, it's to the point where you can't stop scratching. It bleeds, and once it starts to bleed and it starts to heal, it really hurts. I didn't want to wear anything that didn't cover my foot, because I didn't want anyone to see my feet, you know. But yeah, it was pretty bad.
And over time, it will be so dry that it can crack. That open flesh could crack open and create fissures, which causes the pain.
Yes.
You also were affected in other places besides your face and your eyes. I mean, you did have eczema on your face.
Yes.
As well as your eyelids, your neck.
I don't remember my neck.
Okay. Your arms?
I know all of them.
Your forearms?
All of my arms, yeah.
And the sides of your legs?
Yes.
All right.
Yes.
So, typically, according to degree of eczemas, the surface area of one palm is considered 1% surface area of your body. A severe case of eczema is considered greater than 10% coverage. So you were probably close to about 10% coverage. All right, so your case of eczema is probably considered severe. So, you know, you don't have to feel so bad about that. So, I guess you already kind of explained who diagnosed you with the eczema, but would you describe how the eczema looked when it was at its worst with the other areas of your body, your arms, and maybe even talk about your fingernails?
Oh yeah, that's a good thing that you brought that up. My fingernails were always rigid, and I couldn't understand why my nails looked so rigid, and they had these little bumps in it. And after I went through Dr. Uchida's wellness program, my fingernails, it's smooth, and as far as getting to the point of how bad my eczema was, I would scratch all the time. Every time I ate something, I would scratch. My eyes would get itchy. I would have to use medication for my eyes because of, according to my regular doctor, I had conjunctivitis. And the only reason why I hesitated to use that medication all the time was because the doctor told me that you can get blind. Yeah, because of the whatever's in the medication.
The steroids.
The steroids.
Mm-hmm.
And as far as my feet was concerned, yeah, my feet would bleed and crack, and it was not comfortable.
I would imagine you suffered for a while. Why did you decide to come in and see me and try naturopathic medicine back then?
Because every time when I went to the regular doctor, they told me that this was the problem, gave me medication, and I didn't want to take prednisone. They gave me prednisone to take, and one of the side effects of prednisone is you gain weight, and you have a heavy appetite. And I'm not sure if it decreases your immune system.
It does.
But after I went through all of that and dermatologist, I said, you know what, I have to go see Dr. Uchida. My son kept telling me, Mom, you need to go see this doctor. So I finally came for my eczema, nothing else, just for my eczema. Dr. Uchida gave me this cream to use, and he told me that I had to change my diet. Well, I remember using the cream, and in a couple of days the itchiness started to go away. But he told me that was just part of the remedy. I had to change my entire diet, and that was the reason why I came to see you, because I was tired of seeing a regular doctor.
And changing your diet was hard. I mean, you had mentioned that when I told you you'd have to change your diet and cut out a lot of those foods. You said, no way. But you were, brave enough and tough enough to do it, and we'll talk more about that in a little bit. How did your son hear about me?
My son works at the shipyard. I also work in the shipyard, and his instructor at that time was
Milton.
Milton, yeah, Milton. I don't know what Milton's last name is, but Milton always shared with his students about health and how bad his health was. And he talked about Dr. Uchida and how Dr. Uchida helped him. And everything started with diet. And my son got his card, got Dr. Uchida's card, and brought it home to me and told me, Mom, you need to go see Dr. Uchida for your migraines. And I looked at his card, and I put the card in my drawer, and that's where it stayed.
So he actually told you to see me for your migraine headaches?
Yes.
Okay, and that's actually a good segue, because I'm gonna ask you about that.
Yeah.
But you came in to see me for your eczema.
Yes.
But you also suffered from migraine headaches.
Exactly.
How bad were they, and how long did you suffer from these migraine headaches?
I've had migraine headaches since I was 12 years old, and as I got older, I noticed that my headaches got increasingly worse, to the point where I would get an attack maybe every week. It was very debilitating. I couldn't go to work for maybe a week if it was really bad, but I would get an attack almost every week.
You were suffering quite a bit. So you'd get an attack every week. How long was that going on?
At least 20 years.
20 years, okay. And you obviously tried a lot of medications for it, and they didn't help you so much.
No.
If you were getting these attacks every week. A lot of people haven't suffered from migraine headaches in their life. Would you share with them the experience you felt when you had your migraine headaches, with the pain and where the pain was and how bad the pain was?
A lot of people, they have migraine headaches. When they get their migraine headaches, a lot of people have it in different areas of their head. But a lot of people said they have pains behind the back of their eyes. And my pain always started on my right side temple, always. The pain was so bad, it's like somebody putting your head in a vice and just squeezing the vice every time. With the pain in the back of the eyes, you become very sensitive to sound and to light, and even to smell. And that wasn't the only thing. The other thing that I suffered was I was always throwing up. So whenever I had an attack, I would throw up to the point where I would dry heave and nothing would come out.
Okay. And that's a common occurrence with migraine headaches. Nausea often accompanies migraine headaches. And I guess your nausea was quite severe.
Mm.
And if you experience your migraine headaches every week, you are suffering from nausea every week. And I think a lot of my patients will agree with me that if you are nauseated, you just don't feel good. I mean, there's nothing that can happen. You could win $1 million, and you still wouldn't feel good because you just suffer with that nausea. You had mentioned that you were sensitive to light and to sound. A lot of people who have never experienced migraine headaches really they wouldn't understand what that meant. Basically, I think light and sounds would aggravate your migraine headaches.
Yes. I want everything quiet. Even if someone came into my room, just to tiptoe in my room, I already knew somebody was there. And I didn't want anyone around. I didn't want any sound. The curtains had to be drawn. My doors had to be kept closed, and I didn't want anyone to bother me, period.
Mm-hmm. So any type of sound or noise or light would aggravate you.
Yeah, I just get irritated.
Right. And poor Gail, that wasn't all, right? You also suffered with depression.
Mm-hmm.
So a lot of people are thinking, yeah, if I had chronic migraine headaches like that, as well as an eczema that I would suffer from, and eczema is torturous because it just itches all the time, especially when you're trying to sleep. You can't sleep. You just are scratching, and you never really get really sound sleep.
Right.
So they would think, yeah, I would have depression too, but Gail, your depression was not mild.
No.
Would you share with the audience your depression, how bad it was, how you suffered, how long you suffered from the depression?
Yeah, well, first of all, I suffered from depression for almost 3 years. And it started off as soon as I get home from work, the first thing I would do is go in my room, watch TV. When it was time to prepare dinner, I would make dinner. We would eat, and after dinner was done, I would wash the dishes and go back into my room. It got progressively worse where I would come home from work and I would just stay in my room. I wouldn't even cook dinner. I would have someone else take care of that. And then it got to the point where I would miss a couple of days of work. And then got to the point where I wouldn't even get out of bed. I just didn't want to get out of bed.
Mm-hmm.
Sometimes I didn't even want to take a bath. I didn't want to take a shower. I didn't want to brush my teeth. I didn't want to comb my hair. I just was not interested in anything.
Mm-hmm. And you just, over time, didn't want to leave your house.
Yes, I didn't want to. I didn't want to leave my room.
Your room. And you suffered with this for 3 years.
Mm-hmm.
Obviously, it must have affected your family.
Well, you know, anything that happens to you will affect your family.
Mm-hmm.
But I think one of the things that I'm blessed with is I really had a supportive husband. You know, he was there for me all the time,
Mm-hmm.
and he always told me that things will get better. Things will get better, and I think because of that, it helped me too. To stick with whatever I had to do.
Mm-hmm.
But if it wasn't for a supportive husband, I don't think I would have probably made it through.
Did you seek help for your depression?
I did. I went to see a psychiatrist. The psychiatrist put me on medication, and she also gave me some exercise to do. And the exercise is not physical exercise. Exercise was more mental exercise,
Mm-hmm.
to the point where I had to actually get out of my room and do things within the house. And then it became gradual where I had to step outside of the house. And then from there it became I had to go into the car and do something else. So it was those kinds of exercise that the doctor helped me help me with.
So it sounds like that helped you somewhat.
It did, I think, a little, but
A little, okay.
I still think diet has a lot to do with it.
Okay, so you were still suffering from the depression
I think a little.
when you came in to see me. So, all right. What did I say was causing your eczema? Because you didn't really tell me about your depression when you came in. You
No, I didn't.
basically only came in
For
to
my-
get treatment for your eczema. Now, why did you choose the eczema as opposed to the migraine headaches and the depression?
I guess because my feet was so bad looking,
Mm-hmm.
and because of the time that my husband was working on the kitchen cabinets, and I could see the pores so
Large.
enlarged, I said, I have to come to see you for that. I don't know why, but that was so important to me because it itched, constantly.
Yeah.
So I came to see you for that reason.
Okay. Did you think that naturopathic medicine or I could have helped you for the depression?
Yeah, I did.
Oh, you did? Oh,
Yeah.
okay. Because I think a lot of people wouldn't think that changing your diet would help alleviate depression.
I don't know if changing my diet, because when we talked, that's the first thing you told me.
Mm-hmm.
I knew naturopathic was the way to go. I
Okay.
just believed in it,
Okay.
and with the things that I was reading. But when you talked about diet, that was kind of hard.
Yeah, it is for most people because the diet change is pretty dramatic.
It is.
Right, so before we talk about what diet I put you on, let's go back and talk about what did I say was causing your eczema as well as your migraine headaches and depression.
You said it was what I ate.
Okay.
Everything that I ate affected my eczema and my migraines. We didn't talk about depression too much, but it was whatever I ate.
Okay. So basically we were treating an infection that will cause systemic fungal infection. And the main reason was because you had an appendectomy, a few years back, which then your symptoms came on after that. So we've talked about systemic candida infections a lot on this program before, so we're not going to go into that today. Did you believe a diet change would alleviate your problems?
I think when you talked about some of the foods that I had to avoid,
Okay.
and when I started to ask you questions
Okay.
why, it made sense.
Okay.
Especially the yeast. Yeah, anything to do with the yeast part. That made sense to me.
Erythrodermic eczema is the most inflammatory form of eczema. Erythrodermic eczema can affect the entire body. It is characterized by its fiery redness and extreme shedding of skin. It is often accompanied by severe itching and pain. Erythrodermic eczema causes severe protein and fluid loss that can lead to severe illness. Severe swelling around the ankles are common and may develop into infection. The body's temperature regulating system is often disrupted, producing extreme shivering episodes. Erythrodermic eczema can cause life-threatening infections, pneumonia, and congestive heart failure. The most common known trigger of erythrodermic eczema are the chronic use of systemic corticosteroids medications. The typical medications used to treat severe cases of eczema are systemic steroid medications such as prednisone and steroid injections, as well as chemotherapy medications like methotrexate. As you have heard and seen on my last programs, many of my eczema patients have come in to see me suffering from the erythrodermic form after they have been prescribed systemic steroid treatment for months and or years. Well, let's talk about the diet for the audience, because that's the key to getting well. A lot of people, unfortunately, we don't realize that the foods we eat actually do make a difference in how we feel, and maybe in creating disease and illness. I think a lot of people understand, maybe diet can affect cardiovascular disease and diabetes, more severe type chronic illnesses, but not realizing that maybe it could be affecting migraine headaches, skin problems, and or depression. Would you explain which foods you had to eliminate from your diet for the audience?
Oh, I had to eliminate a lot of foods.
Okay.
All the starches.
You gotta make me sound better.
All the starches,
Okay.
like rice,
All right.
potatoes. I had noodles, pastas, a lot of stuff.
Okay.
Tomatoes.
Cookies,
Oh yeah.
cakes.
Anything to do with sugar, you had to eliminate. And I asked Dr. Uchida why, and he said sugar can cause depression, and sugar can cause the eczema to flare up. So I didn't kind of like believe him because I figured sugar, but yeah, after a while you
You got better.
you can see.
Yeah.
You can see the difference.
All right. I'm going to mention a few other foods so the audience has a better idea. So sugars, yes, but a lot of people really don't understand that white rice might be a simple carbohydrate, as well as potatoes, noodles, pasta, bread, crackers, cookies, breakfast cereals like Cheerios and Wheaties, oatmeal we have to eliminate. Cream of wheat would be considered a simple carbohydrate, as well as vinegar and alcohol, fruits too, right?
Yes.
As well as dried fruits like raisins and dates, juice and soda, dairy products, so that's milk, butter, cheese, yogurt, sour cream, cottage cheese,
all the good stuff.
Butter, all the good stuff. But there are things that you can eat, and we'll talk about that a little bit. Corn, soy, fermented foods, right? So like mushrooms and miso and soy sauce. Eggplant, bell peppers, tomatoes, peanuts, pistachios, macadamia nuts, cashews, walnuts, because they're related to yeast also, as well as pork. I think we've got them basically all for you. So there's a lot of foods that you have to eliminate. I'm sure the audience can feel for you when you were saying, I didn't think, well, one, I don't know if this will work, and I don't know if I want to do this or not. But you did it. You did it. You followed the diet. So would you tell the audience what happened after a few weeks or a few months after you eliminated those foods?
Well, first of all, I remember you telling me if I wanted to eat chicken, I had to eat organic chicken.
Mm-hmm.
And I said, what is organic chicken, right? So I go down, and you told me what, market to go to. So I went to that market, and I looked at the organic chicken, and I said, no way. Because it didn't look like the regular chicken that you buy in the supermarket. Organic chicken is more in the whitish, kind of like grayish color.
Okay.
And the regular chicken that you look at is like red and pink, and so I said, well, Dr. Uchida said organic chicken, so I had to eat chicken. So I brought the chicken home, I cooked it, and I have to say that was the best chicken I've ever ate. And food started to taste so much better.
Mm-hmm.
You could taste the food.
Mm-hmm.
It wasn't covered up with all these spices that you had to use.
Or the sauces with sugar in it. Yeah.
And things just started to taste better.
Mm-hmm.
And you didn't crave for the things that you thought you would crave for.
Mm-hmm.
It was really different.
Yeah. And it's not only organic chicken, though. You can also eat hormone-free chicken.
Yes.
Which you can find at any store, basically. But Tyson and Foster Farms chicken is hormone-free.
Yes.
So, but the foods do taste better. A lot of patients are leery. They're thinking, man, that looks a little funky.
Yeah.
Doesn't look like what I'm used to eating. But they find out that it does have more taste.
Yes, it does.
Because there's probably less fat in it. All right. What happened to your skin after about 6 weeks on the diet?
Oh, my eczema started to clear up. Well, first of all, the first thing I noticed was the pores on my arms were gone. And that was like, whoa, And then I noticed the eczema on my feet started to, it was there, but it started to get a little less.
Mm-hmm.
And then I noticed my fingernails, the ridges on my fingernails were like, wow, it's getting so much nicer, you know?
Yeah.
And the itch around my eyes was gone, just gone.
Mm. We should talk a little bit about the ridging on your nails, because a lot of people might not realize or understand what that is. So the length of your nail would have like seams or ridges growing down the length of your nails, and you'd have bumps on your fingernails, right?
Yes.
And which is common when people have like psoriasis or maybe bad eczema and or fungal infections in their nails. So your nails started to clear up.
Yeah, that was the first thing I noticed was, oh, my nails look so much nicer. And then my eyes didn't itch anymore. And then, I don't know when I noticed it, but I didn't have to use my eye drops. I've never used my eye drops ever since I came to see Dr. Uchida, and that's been, almost 2 years?
Almost 2 years now, yeah. So the itchiness and the inflammation in the eyes.
It's all gone.
All right. What happened to the migraine headaches during the first 6 weeks or so?
I don't know if it's like withdrawals, but of course I got it, but it wasn't as bad.
Mm-hmm.
And I noticed the severity of my headache wasn't as bad as it used to be, and I didn't have as many attacks as I had before.
Instead of
having one every week, I would have it every other week.
Okay.
So that in itself is like a milestone for me.
Yeah, yeah. All right. And what happened to the depression?
That's so funny because I think you were telling me sugar has a lot to do with how your body reacts, and I noticed that once you cut out sugar, all these things start to disappear.
Yeah. So your depression was much better, probably because you had more energy and your mood wasn't so up and down,
Yeah.
right? You were a lot calmer and you felt, I guess, more steady.
Yeah.
All right. When did your eczema improve about like 90%?
I think it was almost a year after I came
After.
to see you.
All right.
Almost a year.
Okay. How would you describe how your eczema looked?
Flaky.
After it was a lot
after?
better.
It's like you didn't think I had eczema.
So it's completely gone.
Yeah.
All right. When was the last time that it looked that good? Because when you got about 90% better, it was like February 2008. When was the last time it had looked that good? Before February 2008.
I don't know.
It was a long time. All right. How was the itch to your feet and your hands and your skin at that time?
Back in 2008.
Mm-hmm. February.
Yeah. Before 2008 it was bad.
Mm-hmm.
After 2008, it's
Basically no itch.
yeah.
All right. Tell us about your migraine headaches now.
Well, that's another thing. I notice I don't have my attacks every week or every other week. I think I had an attack about 6-7 weeks ago,
Okay.
and I used to get really bad attacks before that. Like, I don't know how often, but I think maybe so far I've had only 3 really bad attacks since 2010,
This year.
this year.
Mhm.
So when I say 3, I mean that's so much better than before.
Then every week. All right. What do you think about that improvement?
That's wonderful.
Yeah. Did you ever think you could get to that point where
No.
you'd only have like 3 migraine headaches in a year as opposed to 4 a month or so?
No, never.
All right. What happened to the damaged fingernails and the ridges?
It's all gone.
Completely gone?
Completely gone.
Completely gone. All right. Tell us about your depression now.
I don't have any depression.
When was the last time you felt like you were depressed?
2008, maybe.
2008?
Yeah.
So, you're not taking any medications?
No medication.
Any medications for your eczema?
No.
No. All right. Okay. So, how do you feel about that? I mean, that must be pretty life-changing for you. You know,
Oh,
not
yeah.
having the depression anymore. Because I know, what you were sharing with the audience is you were just, when you see that TV commercial of that person walking around with that huge dark cloud over their head. I mean, yours was a lot worse because you didn't even want to leave the house.
Mm-mm. It's I don't know how to explain that. Although modern medicine is there for you, I don't think they're there to just mask the problem, but not cure the problem. And I don't know why we don't have naturopathic medicine covered under our insurance. And I think we all know the reason why. But for anybody who needs help with anything, I think naturopathic medicine is the only way to go.
Thank you. Well, you certainly made dramatic improvement, that's for sure. You originally came in to see me in July of 2007, and by February of 2008, about 6-7 months after you started, you were literally at least 90% better in all your symptoms. Did you think you'd get better that quickly?
No.
No.
Because you told me at least a year, 12 months. You said with being on the diet, a strict diet, I might be able to get healthier faster. But it all depended on how much effort I put into it.
Mm-hmm.
And I was determined to put my effort into it.
Yeah, you did really well, obviously, right, to get that kind of a response that you did. How does your husband feel about the improvement that you've made? Because he probably has noticed it maybe the most. I mean, I know you have children, but, you know.
I don't know. I've never asked him. I think if I was to ask him today,
Okay.
he probably would tell me that he's real happy that I'm more, I'm able to do things more. I don't have my attacks, so I don't use that as a reason why I can't do things.
Mm.
But so now I'm more involved with doing things with the family. I'm also on a bowling league.
Oh, really?
I bowl now, and I do more things with on my own, like going out with my girlfriends.
Terrific.
Before I never did that. Yeah, I think my husband would say that he's happy.
A different person.
Yeah.
Did you bowl before? Like,
No.
let's say 10, 20 years ago? No.
Maybe when I was younger.
You bowled a couple of times.
Yeah, but.
So
after-
this is different for you.
Yeah.
So you have a lot of energy
Yeah.
because you want to go out and do stuff
Yes,
now.
yeah.
So yeah, and you're not forcing yourself to do it.
No.
So your psychiatrist is not telling you, Gail, you gotta join a bowling league now.
No, I haven't seen her since 2007, I think.
Okay.
I haven't seen her since. I don't think I've seen her since I came to see you.
Okay, that is big. You also had high cholesterol levels also before you came in to see me. Would you share with the audience, what your cholesterol levels were like and then what happened to them after changing your diet?
I think my cholesterol was like 3 something.
Mm-hmm.
I think, I'm not sure exactly, but
It was pretty high.
yeah. And my doctor wanted me to go on this medication, and every time they want me to go on this medication, I tell Dr. Cheetah, my cholesterol's high, so he gave me some Colease to take, and I think my cholesterol came down to 1 something.
Yeah, it's a cholesterol lowering supplement that's safe for the body, doesn't have any side effects. Your cholesterol levels was at 320 before you came in to see me, and it went down to 170 with the diet change and the supplements.
Yes, diet change. So important.
Would you share with the audience, because they learned what foods you couldn't eat, but would you share with them what you are eating or what you did eat at that time?
I eat a lot of vegetables, like broccoli, broccoli, cauliflower. I ate, I can't remember.
You ate a lot of chicken.
That I did.
How about fish or
I eat a lot of fish.
turkey?
Oh, turkey. I remember you telling me I could eat turkey, so I found turkey bacon and turkey sausage.
Okay.
Oh, and I could eat eggs too. But for breakfast, I had turkey bacon, and I had these little rice cakes. Not rice cakes, but
Brown rice cakes?
Brown rice cakes.
Mm-hmm.
Well, the first time I had that, it was like, yikes.
Yeah.
But
like eating cardboard?
But I toasted it, and I put some almond butter on it.
Mm-hmm. Mm-hmm.
And people, when I say almond butter, you would think it would taste really good, right? But almond butter really doesn't have that much flavor, yeah?
Okay.
Right?
I like it.
Oh, you do?
But yeah.
Okay, so
But
anyway.
it's like peanut butter. The only difference is they make it with almonds.
Almonds,
right,
yes.
okay.
And
Without
so
the sugar though.
Yes,
Yeah.
without the sugar. So when I put the almond butter on it, it tastes a lot better than with it like that. But when you toast it, it tastes even better.
Even better, yeah. Because it becomes more crunchy, crispier.
Yes.
Yeah.
And so that's what I would have for breakfast was my turkey bacon and that brown rice cake.
So the diet wasn't that bad. You
No.
had foods to eat.
Oh, yeah.
You didn't starve.
Pumpkin, squash I had,
Mhm.
yeah.
Yeah. So, you know, you're eating a lot of turkey sausage, turkey bacon, chicken hot dogs, chicken, fish, but your cholesterol level still came down quite a bit. And even eggs, you're eating eggs, and your cholesterol level still came down quite a bit, mainly because we cut out the other things that raise cholesterol, which a lot of people really don't understand, is sugars can raise cholesterol levels. Um, but, you know, you're not on that diet anymore.
No.
Right? Okay.
We're adding back things into my diet.
Okay.
Slowly.
So we were basically testing for food sensitivities, and we're reintroducing foods that we eliminated from Gail's diet back into her diet now, one at a time.
Yeah.
And we're testing for food sensitivities. Would you share with the audience what happened when you tested coffee?
Well, coffee, I just got all jittery and I got nervous. I mean, I would itch. Not a lot, but I would itch. So I know coffee is a no-no.
Coffee also brought your migraine headache back.
Oh yeah, definitely.
Was coffee a favorite thing of yours?
Not like how people drink it every day.
Okay.
But I mean, I would have a coffee once in a while.
But it wasn't a daily thing or ritual where you didn't drink like 3 or 5 cups of coffee a day. Okay, so you didn't miss it that much? Okay. Were you surprised that you reacted to coffee in that way?
Mm-hmm. Well, I know caffeine will always give you a migraine,
Mm-hmm.
migraine headache, but I think when you drink it like that and it just comes within 10 minutes, I would get an attack.
Okay.
But same thing like MSG.
Right.
Within 10 minutes of taking something that has MSG in it, I would get an attack.
A migraine headache. Okay. And we obviously eliminated that also from your diet. You've tested most of the foods that we eliminated from your diet now. Would you tell the audience which foods triggered a reaction? And if you can remember what that reaction was.
Oh, I know.
I have a list.
I know cheese. I cannot eat cheese. I know I cannot eat rice, white rice.
Mm-hmm.
I know I can't eat any starches, breads.
Pasta, crackers. Okay. What happens when you eat the white rice, bread, pasta, crackers?
I start getting those like pearl, like blistery stuff comes out again.
Mm-hmm.
And then my skin would itch, and then it would crack, and then it would bleed.
Mm-hmm.
But that's what would happen.
So the dyshydratic eczema would come back. Were you surprised that rice and pasta did that to you? How do you know the rice and pasta and noodles and...
Oh, because all those foods that we eliminated,
Mm-hmm.
as we start to test those to be put back into my diet, I think one of them that we tried to test was cheese.
Mm-hmm.
Because you asked me, what do I want to eat, put back into my diet, and I said, I want cheese.
Right.
And so when we tested for cheese, I noticed that that was
A bad food for you. All right.
bad food.
Okay. Were you surprised that you also reacted to eggplant, oatmeal, and potatoes?
Oh yeah.
Were you surprised that you reacted to all those foods and why?
I think in the beginning I did, but when I asked you, you explained because of the enzymes in the food
Mm-hmm.
and the levels of sugar that it has. We don't think that oatmeal or breads have a lot of sugar in it, but it does.
Mm-hmm.
And I think the eggplant, because of the enzymes in it, and I think that's the reason why I would get a reaction.
Okay, sort of like that. Eggplant, tomato, bell peppers, and potatoes are part of what is called the nightshade family vegetables. And they're called the nightshade because in the old country in Europe, those vegetables are related to belladonna, and belladonna is a poison. So there's some atropine-like chemicals. Belladonna's poison is atropine. There's atropine-like chemicals in those foods that it won't kill you, but you can cause some reactions in your body. Gail, obviously, a lot of people are thinking, okay, you cut out all the good tasting foods, right? We would expect some weight loss. How much weight did you lose?
I think it was 130 something. And
To start?
And I think you told me I came down to 119.
Yeah. You lost, you went from 135 to 119. You lost 16 pounds in that period of time. And for you, that's quite a bit of weight to lose. How do you feel about that?
Ecstatic.
One of the benefits of the treatment. That wasn't your goal, but
No,
it just
no,
happens.
yeah.
All right. So, you know, your migraine headaches are a lot better. Your depression is gone.
Gone.
Your eczema is virtually gone, if not eliminated. How do you feel about naturopathic medicine now?
Whenever people that I talk to tell me that, oh, this is wrong, I have this, the first thing I always tell them, and I always take some of your brochures with me, you have to go see Dr. Uchida. So that's what I always tell them. I said, you need to go see Dr. Uchida. But it's up to the person, right? You can't force them to go. You can provide them with the information and they can make their decision, but that's the first thing I would tell them is to come to see a naturopathic doctor.
Well, thank you. And hopefully just naturopathic medicine in general.
Yes.
Because we don't perform miracles here. I can't wave a magic wand and, your symptoms will disappear. But we can eliminate obstacles to your health, and that's what naturopathic medicine is really good at. Because a lot of the times when we feel bad, it's because what we're doing to ourselves, what we're eating, what we're drinking, maybe our lifestyle or our habits could be causing some problems for us. So a lot of times, unfortunately, most of us try to look outside of that, try to get help, maybe if I take this pill or do that. But if we start with ourselves first, we can start to eliminate some, if not the majority, hopefully all, of these problems. What would you like to say to anyone who is suffering from eczema? Because a lot of people suffer from eczema. It affects maybe around like 10% of the population on a regular basis. And a lot of people are going to their medical doctors, dermatologists. They're receiving corticosteroids or immunosuppressive drugs, and the eczema typically is just getting worse. What would you like to say to them?
All I can say is doctors, I know the medical field is there, modern medicine is there, but they're just there to mask the problem. They're not there to cure the problem. And I have to say that naturopathic medicine is going to cure what you have. People say that, oh, we can't cure this, we can't cure that, but my eczema is gone, my migraine is decreased, I don't have any depression. I just believe in naturopathic medicine.
You had mentioned that the medical doctors will say we can't cure this or that. So basically, conventional medicine, if you have eczema and you ask them if that corticosteroid or the prednisone will cure my eczema, they'll tell you no, because it only shuts the immune system down.
Exactly.
It's an immunosuppressive drug. So it doesn't address the cause of the eczema, which are the poisons in the body, which we address through diet and the supplements that we have given you. You also took some supplements too. We can't forget about the supplements.
Right.
Would you tell the audience something about the supplements or how they work, or if they work? And how did you feel that it worked?
Yeah, I had to take supplements with my meal, and I had to take supplement after I ate, and I had to take supplements in between my meal. And the first thing I noticed when I took the supplements was I never went to the bathroom regularly. I didn't have a regular bowel movement, but I noticed that when I started to take the supplements, I went at least twice a day.
So it improved elimination. And
and
that's helpful.
Well, not only that, you feel so much better, People will tell you, I would hear people say, oh, they feel really good, but until it happens to you, you don't know.
Right.
You won't know.
That's true. Unless you feel it, you don't know how it feels. And that's what a lot of my patients will say is, they thought before they started naturopathic medical treatment that was just the way they are.
Yes.
That's you. I have migraines and nothing can change it. I have skin problems, nothing can change it. I don't have energy, nothing can change it. But when you have the energy and you feel good, you know how that feels.
Exactly.
And most of my older patients, the first thing they talk about is their bowel movements.
Yes.
So moving their bowels are very important
I'm
for them
old.
as well as for most people. So if you're regular, you're happy, right? So as soon as you move your bowels, then the day can get started, and I guess that's what you're talking about.
Yes.
You
I
don't
mean,
know.
it's so different. I don't know how to explain it. I just don't know how to explain it. I would go to the bathroom, but not even once a day.
Yeah.
And so when I started to take the supplements and I would go, it's like, oh, this feels really good, you know?
Mm-hmm.
But yeah, that's the first thing I noticed.
And we didn't give you anything to increase your bowel movements. You were taking 4 supplements basically. One to help you with digestion and
Yes.
to help regenerate your digestive tract. So that's probably one that helped your bowel movements. The second one was a probiotic, meaning the good bacteria that we're putting back into your body and in your small intestines, because that also helps with digestion as well as elimination. So that's the second supplement that probably helped you. We gave you a broad spectrum natural antifungal to help eliminate the fungus out of your body, because conventional medicine antifungals really can't cure fungal infections. And if you're a patient of mine, we go through the medical books and it states that. And the fourth supplement is something for your liver, kidney, and colon. So it's going to help clean out, tune out those organs, and that probably helped your bowel movements also. What would you like to say to anyone who is suffering from migraine headaches? Because, that is, that's no fun.
No.
Because it was like you're getting hit with a sledgehammer once a week. And you just feel miserable. You don't want to do anything. You just want to lay down in your room in darkness.
Well, for those people that suffer from migraine, that certain foods will trigger it. But I think a lot has to do with your total diet. It's not only watching the foods that trigger the migraine, but it's a whole total diet change. And when I did a total diet change, I noticed that my migraines, started to decrease a lot.
Right.
So, although, watching what you eat is part of the problem, I think you can go beyond that and really help yourself, get better by watching really your whole entire diet.
And that's a good point, Gail, too, because a lot of people will say, okay, I'm going to change my diet, but I'm just going to cut out wheat and see if wheat is affecting me. But a lot of times you're not going to see any improvement because, one, even if wheat is a problem for you, you might have problems with eggs,
Yes.
or with tomatoes, or with alcohol. And if you don't cut out those other things too, you're not going to feel any better. So that's why we have to go all or nothing.
Yes.
So it's basically all in, that's the term they use today. We have to eliminate all the most common food allergens and sensitivities and problem foods out of someone's diet. Then you can experience getting well quickly, because we don't want to be on this diet for 5 years before we start feeling better.
Exactly.
We want to start feeling better within a couple, 3 months. And when you do start to feel better, then it makes it easier for you to continue to get completely well.
Yes.
All right, Gail, great. What would you like to say to anyone who's suffering with depression? Because that is another story. Because a lot of people feel depressed every now and then. My favorite football team lost. I know a lot of people were slightly depressed last Friday when the University of Hawaii football team lost in the Hawaii Bowl.
That was
But
sad.
I was sad. But people experience that kind of depression, but yours was deep and dark. And there are a few people out there who suffer from that kind of depression.
Like I said, medication is good, but you can't be on it forever. Sooner or later, something else is going to happen where they're going to say, we need to increase your dosage, or we need to look for something else. And that's not a cure. And I truly believe that watching your diet, totally watching your diet, and going on the diet that Dr. Uchida gives you, I know that it's going to cure you. You know, everybody has good days, bad days, but to feel depressed is that's not living.
Mm-hmm.
That's not living at all.
Yeah.
And to think that the doctor's medication is helping you, that's not a cure either.
Mm-hmm. So there is another option. I mean, you know, it's not an appealing option for a lot of people because they think, oh my God, you know, I have to really change my diet and my lifestyle. But if you really want to help yourself, that's one way and one option to go.
Yeah.
It's not an easy way, but it's something that you can do for yourself and you can really make a difference. All right, Gail, you know, thank you so much for sharing your story with us. I'm sorry to say that our time is up. Would you like to say anything else to the audience before we end our program?
No, the only thing is I can say is, you know, if you have symptoms, if you, cancer, I noticed Dr. Uchida has foods about cancer preventing foods, anything. Naturopathic medicine is the only way to go. I truly believe that. I really do.
It's what Gail is talking about is, you know, Dr. Uchida's diet. It's not really my diet, but it sort of is. It's a naturopathic medicine kind of treatment. My diet that I put my patients on are basically the strictest among most naturopathic physicians. I think probably because some people, they don't think their patients can follow a really strict diet, so they want to make it easy on them. It's not that I'm mean. I want to make your life miserable. But I put my patients on this very strict diet because I want them to get well. And I want them to get well as fast as possible. And that's why the diet is so strict. But if you can perform that diet, I'm sure you're going to get some relief.
Exactly.
And hopefully complete relief, like a lot of my patients have, as you've seen them on the treatment. But it's a naturopathic medical treatment and not specifically mine. But Gail, thank you so much for joining us and sharing your amazing story with us.
You're welcome.
Continued good health and success in the coming decades. I'd like to thank all of you for tuning in and joining us today. I hope you enjoyed the program and learned something of value. I hope that you continue tuning in to Island Wellness and looking for us on a little television. My name is Dr. Jason Uchida. Thank you.